Hi, my name is Ben Miller. I'm a hospital pharmacist. The kids are asleep, the wife's asleep. Let's do some dosage calculations. I recently received an email from a student nurse asking me to help her with some questions she had. So let's start with the first one. So we have a patient who's on Lasix 80 milligrams BID, that's twice a day, and their potassium level is low, and the doctor wants to supplement the potassium. Patient doesn't want to take those giant, I don't know if you've ever seen those potassium tablets. They're like horse tablets. They're huge. So this patient wants to take a liquid form. So the pharmacy has a liquid form in 30 MEQ per 22.5 ml, and the doctor wants to give the patient 40 MEQ. So KCl, 40 MEQ, stat. Doctor wants to give the patient 40 MEQ potassium chloride because they're on Lasix. The generic name is furosemide, 80 milligrams twice a day. So what we have here is available 30 MEQ per 22.5 ml. This is the given concentration, 30 MEQ per 22.5 ml. Always ask yourself, what's the concentration? If you know the concentration, you're going to get the answer correct. Okay, and then we just set up a simple ratio proportion. So 40 MEQ is the dose that we want, and X ml. So what we do is just cross multiply 40 milliequivalents times 22.5 ml divided by 30 milliequivalents is going to give us the milliliters that we need. Grab your calculator or your cell phone and work with me. 40 times 22.5 is equal to 900 divided by 30 is equal to 30 ml. 30 milliliters. So to get the 40 MEQ from the concentration that's available in the pharmacy, 30 milliequivalents per 22.5 ml, you would measure out 30 milliliters, and that'll give you the 40 MEQ. Okay, let's go to the next question. Patient has tonsillectomy for repeated strep infection. Doctor wants Keflex 137.5 milligrams Q6 hours for 14 days. Pharmacy has available 125 milligrams per 5 ml. How many milliliters do you need for the dose? Okay, so we have the doctor wants Keflex 137.5 milligrams Q6 times 14 days. Okay, Keflex, generic name is cephalexin, cephalosporin antibiotic. The doctor wants 137.5 milligrams Q6H every 6 hours for 14 days. Available in the pharmacy is 125 milligrams per 5 ml. 125 milligrams per 5 ml. Okay, always start off with the concentration. If you know the concentration, you're going to get the problem right. The concentration of what's available in the pharmacy is at 125 milligrams per 5 ml. That's a given. It doesn't change. Doctor wants 137.5 milligrams. So we're going to put that on top. 137.5 milligrams XML. Okay, 137.5 milligrams is what we want. So we're going to go 137.5 times 5 divided by 125, and that's going to give us our X value. Grab your calculators. 137.5 times 5 is equal to 687.5 divided by 125 is 5.5 ml. 5.5 ml. Each dose is 5.5 ml. How many doses are we giving per day? It's Q6. There's 24 hours in a day. So divided by 6, that would be 4 doses that we're giving. So if the next question the professor or the examiner will ask you is how many milliliters does a patient take in a full day? So that would be 5.5 ml, because that's how much is per dose, times 4 doses, which you're taking per day. And that gives you 22 milliliters. That's how much they're taking per day. Now, if they go to the next logical question is how much does the pharmacist need to supply the patients to give them a 14-day supply? So if it's 22 milliliters per day times 14 days, okay, and that's 308 ml. And that's the answer to this problem. Let's go to the next one. If you have any problems with any homework questions or you're prepping for an exam and you need help, just send me the question in the comments section or send me an email and I'll make a video trying to help you understand the problem. And if you find any value in this, hit the subscribe and like button. Thank you. So let's go to question number 3. Patient has a thyroid removed and the doctor wants to put them on levothyroxine, 0.05 milligram once a day. The pharmacy only has a 50 microgram tablet. So, Synthroid. Synthroid is the brand name, levothyroxine is the generic name, and we have 0.05 milligram PO/QD. So we're going to get 0.05 milligram PO/QD, and usually you give 30 tablets for a month's supply. So this is a trick question because the pharmacy has available 50 microgram tablets. 0.05 milligrams is the same as 50 micrograms. So just to do a little review of the metric system, you have your base unit, which is gram, and then we're going to do 123 milligram, 123 microgram, 123 nanogram. So milligram is 10 to the negative 3, microgram 10 to the negative 6, nanogram 10 to the negative 9. So when you do these problems, you have to know where you are and where you're going. It's like a GPS. For you to work the GPS, you have to tell the GPS knows where you are, and then you input where you want to go, and the GPS will tell you how to get there. So the same thing. Here you're in milligrams. So milligrams is over here. So from milligrams to micrograms, it's 3 steps, 3 movements. Move that decimal point 3 spaces to the right. So 0.05 milligrams. And you want to go to micrograms. That's where you want to go. So milligrams to micrograms is 1, 2, 3. So 1, 2, 3. You add a 0 here and put a decimal point here, and that gives you 50 micrograms. So trick question, 0.05 milligrams is the same as 50 micrograms. Synthroid, generic name, levothyroxine. Levothyroxine comes in many strengths. Each strength corresponds to a color. I know I've dispensed 25 micrograms, 50 micrograms, 100 micrograms, I think all the way up to I think 300, I'm not sure. You'll have to double check, but it's incumbent on you to know all the different strengths. Your examiner may want you to know that. Okay, so we're going to go to question number 4. Okay. Okay, question number 4. Doctor wants to put a patient on a steroid burst, prednisone, 40 milligrams a day for 5 days. The pharmacy has 10 milligrams in stock. Okay, so okay. Okay, so we have prednisone, 40 milligrams, 1 PO/QD for 5 days. Prednisone is a steroid. The problem is that the pharmacy, prednisone doesn't come in 40 milligram tablets. So the pharmacy has 10 milligram tablets. So pharmacy has 10 milligram tablets. So what you're going to have to do is you're going to have to take 4 tablets. 10 times 4 is 40 milligrams. You're going to take 4 tablets of the 10 milligrams, that's 40 milligrams. So you're going to take 4 tablets once a day for 5 days. So the next question is, how much does the pharmacist have to dispense to give a 5-day supply? So if you're taking 4 tablets for 5 days, so 4 times 5 is 20. 20 tablets. The pharmacist is going to have to dispense 20 tablets. So in reality, the pharmacy is going to write this is the way the doctor would, this is the way in practice I would see the prescription be written. It would be prednisone, 10 milligrams, number 20, take 4 tabs, PO, QD, times 5 days. So that's that. Oh, let me write this a little neater. Okay. So take 4 tablets by mouth, QD daily for 5 days. Prednisone 10 milligrams, number 20. All right, so that's it for the questions that the student had. Again, if you have any questions, just please feel free to contact me in the comments section or the email. Have a good night. Thank you.